Getting pregnant is beautiful. Getting pregnant is always on your mind, especially once you are married. But how soon can you get pregnant? This is a question being asked by a lot of ladies. And they pay attention to maybe just the medical aspect of them getting pregnant. But there are different aspects we are going to run here on what you need to do in order for you to get pregnant as early as possible, especially for those who have been trying to get pregnant and it is not going. If you are just joining us, you are welcome. I'm your host, Tima Dauda for Women's Health Forum. So we are looking at how you can get pregnant as early as possible by looking at factors affecting fertility. So we'll be looking at all of these factors. These are the various factors that will, once you can ensure that this factor doesn't affect you, then you've assured yourself of getting pregnant as early as possible. So let us ride on. The very first factor is timing. Timing has to do with the right time to have sex. The right time to have sex has to do with your menstrual cycle. Your menstrual cycle. So learn how to calculate your menstrual cycle, and once you've known how to calculate your menstrual cycle, then you learn how to get your ovulation. If you get that ovulation, take 4 days before that ovulation and 2 days after the ovulation as your fertile window. So what are we saying? Let us say you've calculated your ovulation, you've calculated your cycle, and it has given you 30 days. It has given you 30 days. You get your ovulation by subtracting 14. We already explained this. Why do we subtract 14? Is because once ovulation occurs, it is generally accepted that it takes 14 days before the next menses. So we just take away the 14 days and we have the answer as ovulation. So every cycle you have, take minus 14. If it's 28 minus 14, answer will be 14. If it's 30 minus 14, answer will be 14. So once you had your answer, 30 minus 40, answer will be 16. So if you take 30, for example, minus 14, you have ovulation as 16. We say it take 4 days before the 16. So we are saying that will be 15, 14, 13, and 12. 2 days after 16 will be 17 and 18. So you see that you have from the 12 to the 18 if you are a 30 days cycle. So you do same for all of your cycle depending on the length of your cycle. By this, you know that every 12th day to the 18th day you have sex with your husband, there is a very high chance of you getting pregnant. For those who are 30 day cycle. But if you are, let's say, a 28 day cycle, obviously ovulation is 14. Why? Because 28 minus 14 is 14. So fertile window will be 4 days before the 14 and 2 days after the 14. And if you calculate that fertile window, it's going to give us 10, 11, 12, 13, 14, 15, and 16. So from the 10 to the 16 will be a fertile window if your cycle is 28. So let us move to the next factor. So that's our first factor. Let us move to the next factor. The next factor is weight. So you need to check your weight. If you're trying to get pregnant, check your weight. What is your weight? Now, to get your weight, to know if your weight has the right quality, because weight is not just looking at the direct weight like that. So you're going to calculate your BMI, body mass index. And BMI is calculated by taking your weight divided by the square of your height. Your weight divided by the square of your height. So we are saying that word. To have your BMI, you take your weight. Let me assume that my weight is 100 kilograms. So 100 kilograms. Let me assume that my height is 2 meters. I take 2 meters. But we say you should do what with the height, you square it. So it will be 2 times 2. A square means that a number times itself. So this equals to 4. It therefore means it will be 100 divided by 4. And what will be the answer? So 100 divided by 4, it will give us a BMI of 25. This BMI, how will you know that this BMI confirms that your weight is good? You come to the normal value. If your BMI falls between 18.5 to 24.5, you consider it as normal. If it falls above 24.5 right up to 30, you consider it as overweight. If you fall above 30, consider it as obese. So this one is 25, meaning this one is overweight. So if it is overweight, what do you do? Try to cut down on the way you eat such that it's going to help you. Now, if you are underweight, what are you supposed to do? If your BMI is underweight, then you actually eat well such that you gain some pounds. Let us move to the next factor which you need to check. So the next one is age. This one we are just saying that if you're trying to get pregnant, please get pregnant as early as possible. Do not wait. Okay? Do not wait. Get pregnant as early as possible. So understand that as you grow older, your eggs also grow older. Okay? A woman is born with all of her eggs that she will need to get pregnant, which therefore means as you grow, your eggs grow with you. So if you are 25 years, your eggs are 25 years. If you're 30, your eggs are 30. Hence, the quality of your eggs cannot be compared to those ones that were a little bit younger. So let's go to the next factor which you need to check in order for you to get pregnant. And this is where most ladies fall prey. Okay, lifestyle. So if your lifestyle is not good, please work on it. So you need to stop alcohol. Okay, stop alcohol. Now, you're not going to stop only alcohol. You need to stop plus sweet drinks. You stop sweet drinks. Okay, that's all the soda. Stop it. Stop smoking if you're a smoker. Stop caffeine. Chemicals. Avoid chemicals. Okay, if you're working in a factory, be very careful with the way you deal with chemicals. Nutrition. Eat a lot of leafy vegetables. Okay, eat a lot of leafy vegetables. Take a lot of fruits and drink a lot of water. Medications and drugs. Please be very careful the way you take medication if you're trying to get pregnant. If not, some of them might instead make it difficult for you to get pregnant. The next factor, which is our last factor, and this is a factor that most ladies pay attention to. This is health and medicals. Health and medicals. Health and medicals here, we're talking about the medical aspect. So there is polycystic ovary syndrome, which is a very difficult situation. You have to go to the hospital, do a checkup to see if you are suffering from polycystic ovary syndrome. Get to your doctor. Your doctor should give you a solution on how you're going to treat it. The next is endometriosis. If you have endometriosis, please get to your doctor. Your doctor should also understand how to treat it. Sexually transmittable infections, in which there are many of them: chlamydia, gonorrhea, syphilis, mycoplasma. This can also affect your fertility. Make sure it is treated. Diabetes. Are you diabetic? Make sure you follow your treatment so that you can keep the glucose level down. Cancer treatment. If you're on cancer treatment, it can affect you. Make sure that you follow up with your fertility specialist on how this can be handled better. Healthy sperm. Your husband's sperm should be checked as well. So with all of this, you're going to improve your chances of you getting pregnant at a faster rate. Now, still on this, I would like ladies to check on what I call silence killer. So there is a silence killer, which is your vagina might harbor some bacteria. These bacteria are anti-sperm that destroy sperm cells. So you can do PCT. So as a lady, try to request for PCT, postcoital test. Let your doctor check. If your doctor doesn't request for it, you can request for it. Postcoital test is going to check if your vagina could be producing something that kills the sperm cells. I hope this help you understand better on what you need to do. Please use our WhatsApp number 6700111404 such that if you have any problem, you can send us a WhatsApp message 6700111404. May God bless you. Do have a wonderful time. I am Tim Adauda for Women's Health Forum. Don't forget to share this video to a friend, and don't forget to follow us on Facebook, YouTube, and TikTok. We are Women's Health Forum. Thank you so much. May God bless you.